This is really one of my favorite quotes, folks. Whoever said winning isn't everything never had to fight cancer. And before our presentation begins, I just want to go over a few things about cancer. Now, over the years, and especially since war was declared on cancer, we've seen tremendous advances in the treatment of the disease. Surgery has become more specific, so it also has chemotherapy and radiotherapy. I mean, there are now technologies that can identify the exact spot of the lesion and reduce it or at least nullify it. Also with immune therapy, and we now know how to use the genes, understand how the genes in cancer can be manipulated and destroyed. And if all that fails, we also know how to cut off the blood supply from the cancer cells. So a lot has gone on since the war against cancer. However, here's the problem. Next year, cancer will be the #1 cause of death worldwide. Why is that so? Well, we don't know everything, but I can tell you some things for sure. Most treatments do not take into account the toxins that are affecting our bodies. And of course, the toxins in heavy metals and chemicals. They also do not take into account the power of nutrition. The power of nutrition to heal, to help your body heal itself, to improve your immune system, to improve your ability to produce blood cells, to improve your body's ability to fight and destroy cancer. They also do not take into account the power of your mind, the psychological needs, the social, and emotional needs of your mind that will help your body overcome the disease. They also, unfortunately, do not take into account our spiritual needs. Most importantly, they do not take into account the ability of the body itself to do the work. And so that is really what our focus has been on with these webinars, helping people understand primarily that the true miracle. And if you give your body what it needs, it will be able to fight and it will be able to do what it takes to overcome. Sometimes that doesn't always happen the way it should. And that is why it is important that we have institutions and establishments that can understand how all these different so-called seemingly disparate elements of health come together: spirit, soul, or mind, and body. And it is always a tremendous honor when we find such an organization. And really, the Cancer Treatment Centers of America have been around for decades. But it's just a wonderful, wonderful honor to have them on our webinar tonight. Before I start to introduce them and before we get into the main presentation, we wanted to have Mr. Ron Gibbons basically talk about his experience in using conventional cancer treatment in a conventional hospital and what the difference made. Really, the difference was life and death. But what the difference Cancer Treatment Centers made in his life. So, Mr. Ron, are you on the call?
Yes, sir. Can you hear me?
I just want to thank you again for it.
Yes.
I can hear you loud and clear. I'm sure everybody else can. Just want to say thank you again for all you've put into this, and thank you for your interest and being willing to share your story. So probably for the next couple of minutes, about 3, 4, 5 minutes at most, we just want to find out what exactly, we know you have a tremendous story to tell. And I know you were initially in a conventional cancer treatment, in a conventional hospital, and they had basically given you up for dead. They said
yes.
They could not treat you, and then, well, why don't you just go ahead and tell us?
Well, when I was originally diagnosed, the tumor grew very fast, and by the time
What kind of tumor was it?
It was a squamous cell drug cancer, multiple locations. Base of tongue was the original site, and then it had spread to a couple other areas in my throat. And by the time I got to the hospital, the tumor was growing at such a rate it was cutting off the blood supply in my brain. And so I had multiple problems along with that. And they actually, at one point at the hospital, the original hospital, there was nothing they could do, and they were basically telling me to go home the commercials from Cancer Treatment Center on the type of radiation that they use there, the tomotherapy. And my wife pursued that, and we were able to be accepted there at the hospital. And,
wow.
I had some great care there, great doctors. My original oncologist there, the first day I met him, he came into my room and sat down on the side of my bed, read my chart, shook my leg, and said, "We're going to save your life." And I knew I was at the right place. And one of the big differences that you see at CTCA over the other hospitals is the not necessarily radiation is just radiation or chemotherapy is chemotherapy. It's the protocol that they put together that makes it successful. Not just the treatments, but overall mind, body, and spirit, and people that actually give you hope every day, and that's what gives you the will to survive. And overall, just like with my pain doctor, Dr. Axness, I would be in his office and he would pray for me. Not only would he take care of my needs physically with the pain, but you left his office with hope because these people care more about than just taking care of your pain or your treatments or everything else like that. They care about you as a person. And that always gives you hope because it's the overall approach that gives you the feeling that there's just more there to be offered.
Right, right. And you had cancer in your throat and in your tongue, right?
Yes, sir.
So really, you shouldn't be speaking right now.
No, I had quite a long journey. It affected not only my tongue and speech, but it affected my ability to eat. I went a year and 9 months without being able to consume food orally. I had a feeding tube, and I had that for 2 years, and tremendous amounts of speech and physical therapy, and just the will to eat again. It was people I don't think realize how important food is in our society because everything revolves around food, and with the fact of not being able to eat, it affects you mentally, tremendously mentally, and that's where the other part of the mind, body, and spirit comes in the hospital. They step in and they help you there, being able to be strong enough and along with prayer, and that's basically what got me back to eating.
Well, how long have you been cancer-free now?
I'm coming up on my 4th year.
Wow. And this is the same person? You're the same person the doctors had said that you had no chance of survival, correct?
Basically about 4 months. 4 months when I left the other hospital was the overall opinion of those people. And I have a little quick story, and then I was at church, and I ran into a lady in the parking lot, and she called out my name, so I went over, and she had her young son with her. And she said, "I've been watching you for the last couple of years, and you've been a real inspiration in my life." And I said, "Well, thanks." And she said, "You don't remember me, do you?" And I said, "Well, no, not really." She said, "I was your nurse in the operating room, in the emergency room when they brought you into the hospital, the original hospital." And she said that when we did the evaluation on you, we didn't think you'd make it through the month. And she started crying. I started crying right there in the parking lot of the church. And, I think God has saved my life for a reason. I've been able to touch a lot of people's lives by helping them, by sharing my experience with people and helping people who are getting ready to go through the treatment so that they're not stepping out into the unknown. They know what to expect. They know that there is light at the end of the tunnel, that, there's only one final say to our life, And, those type of people, just with the way she explained her story and how I helped increase her faith with the way she's seen what we've been through. And, this is what's part of my life. This is why I get involved. And it would, just like with this webinar tonight, it's important for people to know that just because the word cancer is involved in their life, that's not a death sentence. It's just a reason to get organized and to figure out what to do and to go to the right place for treatment.
Right.
Like I was saying earlier, radiation is just not radiation. There's different forms of it. Research what IMRT radiation is, because radiation can do collateral damage, and chemotherapy has to be provided at the right doses, and that's why the protocol of cancer treatment centers, I believe, is so much more superior than what else is out there. It's just not somebody just giving you something to be giving it to you. They're giving it to you for a reason, to save your life. And nutrition is so important involved in this also.
Great. Well, I just want to say thank you so much. I mean, this is a tremendous testimony, and I know you continue to be a blessing to many people, not just here, but around the world. So thank you again.
Well, thank you, and I appreciate all the work that the doctors and nurses do at Cancer Treatment Center. And Dr. Ellison does a tremendous job, and Dr. Axness, like I said, that's just like part of my family now, and I just appreciate everything that they've done.
Thank you.
All right,
well,
God bless you all.
God bless you too.
Right.
Well, folks, there you have it, a live testimony, a live person. All right, now we're going to go into the introduction of our two presenters today, and as I do that, I'm going to have to ask Sherry to go ahead and introduce our guests.
Okay, first I'm going to introduce to you Dr. Mark Axness. He is a pain specialist. He is a board-certified anesthesiologist, and he has a sub-specialty certification in pain management, actually. And he earned his medical degree from the University of California Medical School, followed by an internship and residency at the Mayo Clinic in Rochester, Minnesota. He's actually practiced anesthesiology for more than 20 years, and he joined the pain management department at CPCA in August of 2005. As the director of anesthesiology at the Cancer Treatment Centers of America, he understands the importance of pain control in cancer treatment. And here's actually a quote from him. He said, "We believe that the control of pain results in an enhanced immunologic profile for the patient." So that's a pretty powerful quote. About Dr. Ellison, Dr. Ellison is a licensed psychologist and a marriage and family therapist. He earned a PhD in counseling psychology from Indiana State University. He is one of the mind-body therapists in the mind-body medicine department of CPCA. Here's a quote from Dr. Ellison. He said, "Patients are much more than a set of symptoms, and our goal is to mobilize all of our patients' resources to increase that person's probability of success." Dr. Ellison understands the powerful connection that exists among the mind, the body, and the spirit, between stress and illness, between health and hope. And we are just so blessed and thankful to have both of you on our webinar tonight. So Dr. Ellison and Dr. Axness, are you still both there?
We're here. We are here.
Welcome.
Thank you so much.
Thank you for joining us.
Dr. Axness and I welcome each participant to this webinar. We also want to thank Building Strength Webinars, along with you, Dr. Ajibade, and you, Sherry, for the opportunity to share some of the story that is Cancer Treatment Centers of America. We're on staff at the Tulsa Hospital, and before going any further, I would like to say, Ron and Brenda, we appreciate you a great deal, and thank you for taking your time to share just a tidbit or two about your journey here with us and your journey into health and wholeness. Would like to get started with sharing the values, the vision, and the mission of our organization. We're trying to get our system to work here. Okay, I think we're on target here now. Our vision, our mission, and values are what we aspire to be as an organization. Our vision statement is very simple. It's to be recognized and trusted by people living with cancer as a premier center for healing and for hope. Why we're here is really what drives us, and our mission is why we're here. CTCA is the home of integrative and compassionate cancer care. Our mission includes never stopping the search for and providing powerful and innovative therapies to heal the whole person, to improve the quality of life, and to restore hope. I'd like for you to attend very carefully to the next slide that talks about our values. These values reflect the type of people we are and the type of care we seek to offer. I understand that some organizations arrive at a set of values for that organization, and they probably sound really good when an administrator makes a speech about those values. But these 7 values that we are showing here tonight constitute the core of who we are and what we do every day. Patients expect us to model and to teach these values. But think about it for just a moment, if you would. Staff cannot model or teach these values unless they believe them. Further, staff must use these same values in their relationships with each other, or they will not be able to model them and teach them effectively. When we as staff live these values at work, we help to create a healing environment. And I'd like for you to put a peg on that term, healing environment, because we believe that it's a very powerful part of our model of health care. This healing environment is that environment within which patients and caregivers can thrive and not just go through a plan of treatment. Such an environment, we believe, promotes healing and health, and that's really why we exist. That is, to promote healing and health. And if you would notice our promise, there is laced throughout these statements that we make directly to our patients and to our caregivers. There is laced through these statements a sense of our commitment to the promise, a commitment to our patients. Through all of these statements of our promise, we see hope and empowerment and compassion and all of the 7 values that we just mentioned. Those values, as you've noted, are hopeful and compassionate, empowering, ethical, responsive, innovative, team-spirited. These are the values that characterize this organization, that characterize how the staff deal with each other, and that are laced throughout the promise. And if I could just read those statements, you follow if you would. Our promise is that you and your healing are at the center of our hearts, minds and actions every day. And we rally our team around you, delivering compassionate, integrative cancer care for your body, for your mind, and for your spirit. If you will remember some of Ron's statements earlier, he described not just a one-dimensional treatment program, that is, an emphasis on the medical side of things. He emphasized dealing with the whole person, mind and body and spirit. We offer clear information. We're on the web, we're in books, we go to workshops to find the information that is most up to date and that is most beneficial, useful for our patients. So we want clear information that is powerful, that is a clear statement of a treatment option that's based not on our needs as staff, but based on patient needs. And throughout our presentation tonight, you will hear over and over again that what we do is first and always about the needs of patients. And our promise includes honoring the courage of patients and respecting their decisions and offering to share their journey of hope and healing as much as we possibly can. And then it might be of interest to the audience to notice that we're interested in providing services across our nation, to all the people across our nation. And we present this slide to help you understand what we believe to be the demand for whole person health care. It is a demand that we hear day in and day out. And many times we hear from patients or people who want to be a patient within our system. We hear things like, "We wish you were closer to us," or "Please hurry and build a hospital in our part of the country." I guess the encapsulation of what we hear regarding the location of our hospitals is, we want you to be closer to home, meaning closer to our home, of course. So we've been asking the question over and over again. We ask, how can we serve more people with this model? CTCA is committed to building at least 6 regional hospitals so we can be in reach of at least 90% of the population within the United States of America. Patients travel an average of 514 miles to treat at our facilities. Many of them travel some 2,000 to 3,000 miles or 4,000 miles for the treatment here. Already in existence are hospitals in, of course, Tulsa, Oklahoma, Zion, Illinois, and Philadelphia. We just opened a new facility in Phoenix, Arizona in December of 2008. We have an outpatient clinic in Seattle, Washington, and we hope to have an operational hospital in Atlanta, Georgia sometime in the fairly near future. Plans are moving fairly rapidly in that direction. So the plan is to have services available within fairly easy reach of at least 90% of the population of our country. Let's take a look at some other issues here that may be of interest to those who are trying to understand what Cancer Treatment Centers of America is all about. There was a study in 2007 done by an organization, an independent organization that was hired to talk to 4,000 cancer patients and caregivers across our nation and to ask a key question. Now listen to the question. If money, insurance, travel, and location were not an issue, and you, the patient, could go anywhere for cancer treatment where the care was free or completely covered, and the facility was right down the street, what institution would you, the patient, go to? Now, you may look at those 9 institutions that are listed here. Duke, University of Chicago, Cleveland Clinic, MD Anderson, Sloan Kettering, Mayo Clinic, some powerful hospitals, wonderful hospitals, Dana-Farber, Johns Hopkins. And as the folks, these 4,000 folks responded to the question, what institution would you go to? Notice that some 2% said they would go to Duke, Sloan Kettering, 7% would go there. But we jump on, if we're talking about patients, we jump on to 17%, which ties Mayo Clinic with the, for the highest number in this group. 17% of them said they would go to Cancer Treatment Centers of America. That's the patient population. They're tied with number 1. They are number 1, tied with Mayo. Then the caregivers said that 17% of them said that they would go to CTCA, and 20% said they would go to Mayo Clinic. Now, it's interesting to notice that in 2005, CTCA was ranked number 4 among such hospitals, and here we are in 2009, ranked number 2 among caregivers and tied for number 1 among patients. And you have to begin to ask yourself the question, what's driving the growth? What's driving the popularity? What's driving the demand for the model of health care that characterizes what we do? Well, we're interested in the answer to that question, and so we seek for such answers among people who go to hospitals, among patients and caregivers. You have to remember, as we're talking about our organization tonight, that CTCA builds services around what patients value. Now, we've listed some of those values here, 6 key values that have been identified. These are highlighted by patients and by caregivers over and over again. We know these are the things patients value because we ask them. We ask them. We want to know. Now notice that they value outcomes and quality of life and patient empowerment. They value whole person healing. They value hope and personalized integrative care. And as you look at these data on what patients value, remember that we use these data to improve our services. We draw on tools different kinds of tools to get the information that aids our understanding of what they value. We use surveys, more than one kind of survey. We use focus groups. Now, you may find that interesting if you understand really what focus groups mean to us. These are weekly meetings to which patients and caregivers are invited to talk to administrators, key administrative personnel in our hospital, about their complaints and about the good things that are going on and about changes that they think need to be made and so on. Administrators get an earful, so to speak, every week of information from patients and caregivers. Information that keeps our administrative forces and our clinicians in touch with what is happening in the patient's real world. Obviously, we are involved in board meetings. At the very beginning of the meeting of our national board, there is what's called a patient impact statement. The patient, whoever is selected, the patient is asked, what's going right? What are we doing well? What needs to be changed or improved? Our national leaders use such meetings with patients to keep them in touch with the real world of patients' needs and what it takes to meet those needs. So we use the surveys, the focus groups, the board meetings. We use Feedback Monitor Pro. This is a software program for tracking patient complaints and patient concerns, and also measuring whether or not we respond to those concerns. And may I say, as one of the clinicians in our system, that we are held accountable for addressing those concerns. Then one of the things you may be interested in also about us is that at the very core of what we do is what's called the mother standard. Now, you may not hear that term very often, but we on the staff hear that term a lot. We hear it because that's the standard to which we are held as staff. What is it? It's simply the golden rule. Mr. Stevenson's mother died of cancer. Mr. Stevenson is the chairman of our board and the founder of Cancer Treatment Centers of America. His mother died of cancer, and in the process, he agonizingly witnessed her inability to get what she needed, or the inability of the caregivers to give her or get for her what she needed. And he purposed in his heart, as he watched his mother die, to make effective treatments available to as many other cancer patients as he could serve. He was, and he is now, interested not only in medical treatments, but also in the nutritional, the psychological, the spiritual, the pain management area. He's interested in the areas that affect the patient's ability to recover and get on with life. Or to say it differently, he's interested in whole person health care. So the statement is, we treat every patient the way we would want our mothers to be treated. And we offer integrated treatment options to our patients in order to empower them in their battle against cancer. Now, may I suggest you notice the word integrated. We are not interested in simply offering a set of discrete or separate services. That's one of the things Ron was trying to say in the beginning. We're interested in offering services in an integrated fashion, knowing that different service modalities or treatment modalities interact and they can interact with each other in a way to serve the patient's welfare or to be detrimental. And we are first and foremost interested in those treatments, putting those treatments together that best serve the interest of our patients. We know that what happens in the mind affects what goes on in the body, affects what goes on in the spirit domain. We know what happens in the body affects the spiritual domain, the psychological domain. We know that what the naturopathic physician does can help or hinder other treatments. We know that what happens regarding pain management can color and highly influence every other thing that the patient may do to get better. So we're interested in integrated care. And we define integrated as a multidisciplinary balance of traditional and complementary and alternative medicine therapies that are delivered by caregivers under one roof with a commitment to continuous communication with each other to make sure that treatment is delivered in the most effective way possible. How do we deliver the mother standard? Well, there's traditional therapy, including the medical, the radiation, the surgical oncology. There are the CAM therapies, such as nutrition and pain management and naturopathic medicine and mind-body support, pastoral care, and many others. We deliver all of these services, all of these treatment modalities under one roof, and we communicate with each other regularly to make sure that we're all singing off the same page. We have meetings each week, case conferences among physicians and clinicians to talk about what's going on. We have an aftercare program that is designed to track patients when they are at home, making sure that we are meeting their needs as best we can, even when they're at home. We have a care management model, which means that one particular person, a nurse, an RN, is available to that patient at any point along the way to help keep the treatment focused and moving forward and to help meet those patient needs as they come up. And of course, the weekly patient-focused meetings and our board meetings and our electronic medical record, our records, all are aimed at helping us deliver the mother standard of care. And I'd like to ask you to take a quick look at this next slide, and I'd like to wind up my part of the presentation for right now with this slide. Look at all of the services that are available. There's surgery, there's care management, mind-body medicine, oncology rehabilitation, naturopathic medicine. All of these services are made available much like a large smorgasbord is set for the patient. But the key item that I'd like to point out is not that we offer such a wide range of services, although that's important. The patient is at the very center of all of these services. Remember what I said earlier, that our treatment focus is first and always about what the patient needs. And so all that we do, this whole person model of healthcare, is focused on making sure we understand the patient needs, understand that we have gotten the best treatment available for them, or that we are able to offer that treatment, and that we do whatever follow-up needs to be done following the treatment of that service or those services to make sure that the patient continues to do the best he or she can do. Dr. Axness is going to talk about some of the more technical parts of our treatment approaches and we'll sign off here in a few minutes.
Thank you, Gerald. I'm just really excited to be here tonight. I love to talk about CTCA. I love to talk especially about our patients because they're a very special group. I love talking about my peers and the other clinicians here because I've been in practice for almost 25 years, and it's only been in the last 4 years that I've really found that I've been able to meet or at least come close to my potential. So I'm really excited to be here. I'm going to be talking about a few clinical situations and therapies tonight. Well, we have so many innovative treatment modalities, and we're really only able to cover a few tonight because of time. And this is a listing of some of the things that we'll be talking about. Let me start first by one of the modalities that's very unique. This is an unusual, this is an unusual clinical situation, and this is an example of how our clinicians, specifically our radiation therapists, have come up with treating a very difficult problem. This is a patient who had T-cell lymphoma, and I'll be showing you some pictures to show you the acuity or the difficult nature of this. That again, this is a very unusual clinical situation. And here, I'll show you the picture here. This is how the patient presented this year in the end of February. And as you can see, there are lesions on the back of her head that are nearly eroding through the skin. And lymphomas tend to be sensitive to radiation therapy. The problem with conventional radiation therapy is that it is very difficult to treat this without having a lot of side effects, especially in terms of damage to the surrounding skin as well as the underlying bone and brain. And so this was a very innovative treatment using tomotherapy to the skin area. Now, tomotherapy is what they call IMRT, or intensity modulated radiation therapy. And actually CTCA was one of the very first hospitals around the country to utilize tomotherapy. And basically it is a CT scan type of modality where the patient is imaged and then the same machine is used for the therapy so that you can map out precisely the area that you want to treat and avoid those other areas. And again, we're treating 2 patients for that. And we'll show you the next slide. Now, this was 7 weeks after the initiation of treatment. And as you can see, there's been some resolution of the tumors, actually most of the resolution. A lot of what you see there is a continued healing process. Now, the one thing that I would say is that I personally had not seen this patient in probably 3 to 4 weeks. And so we are now approximately 6 weeks after this picture was taken. And I saw her in the cafeteria yesterday, and it was absolutely remarkable. The skin has completely healed, and the only evidence that you can see where anything had happened was some skin discoloration. So she has done remarkably well. The next treatment modality that was unique was treating tongue cancer. And this is an extremely difficult problem. And as the audience heard earlier, Ron Gibbons, the patient who spoke at the beginning of the webinar, this is exactly the situation that he faced. And the problem with tongue cancers is that, first of all, they tend to be highly malignant, extremely aggressive. And in the past, radiation therapy and especially surgery was used to take these tumors out. And the problem with that is that the treatment, especially with surgery, but even so with aggressive radiation therapy, can leave a normally functioning person almost functionless in society. I mean, just think about it. The speech is taken away, the eating pattern is taken away, as Ron was talking about, it can really destroy lives. And Ron, I know, is a salesman by profession, and he's very good at that. And you know, the ability to or the inability for him to not be able to communicate as a salesman would be absolutely devastating. So in this particular case, the treatment modality was chosen for a patient to use the tomotherapy along with chemotherapy, and then followed by what is referred to as high-dose radiation brachytherapy. And that involves putting very small hollow tubules right into the tumor, and at varying times during the course of a number of days, putting radioisotopes into these tubules and to microscopically treat these. And the advantage to that is that the radiation is extremely focused. And the problem with radiation therapy to the head and neck areas is that you frequently have scarring in the oropharynx. You can cause all kinds of toxicities in terms of shutting down salivation, which can be devastating, problems with swallowing, as well as what they call necrosis to the bones, like the jaw, where the bone can literally be destroyed. So these are all things that the clinicians have to take in mind in treating these patients. But this was a very innovative way of doing it. And this is a picture taken on December 23rd of last year. This was the initial presentation. And the lesion is obvious. And 5 weeks later, this was with, as I said, conventional chemotherapy, the external beam tomotherapy, which is very focused, but also this brachytherapy, which treats it on a microscopic level. The next modality that I will talk about is a diagnostic modality. And this is a General Electric Discovery PET scanner. So I guess this is a plug not just for CTCA, but also for GE. But this is the first one to be installed in North America, and we've had it just for a month. Now, up until this time, we have had PET scanners, but this far exceeds anything that those can do. So this is the first one in North America and only the third one in the world. And so GE is using us as kind of a flagship model for this. The importance of diagnosis is so important in terms of diagnosing, but also assessing how treatment is going during the course of treatment. Now, the advantage with this is that there's a larger bore, which is the kind of donut hole that you see there. So for larger patients, it's much more accommodating, but more importantly, as opposed to most PET scanners, you can get a whole body image on this. Most PET scanners will cut off the extremities because it will not take into account the whole field. The other important thing is that it has what they refer to as a motion-free platform. The importance with that is that, especially in the thorax or the chest area where you're dealing with lung cancers, any of these scanners can get what is referred to as motion artifact, because you're constantly breathing, your heart is beating, it's moving these tissues around, so that to be able to catch these very tiny lesions early on can be very difficult. And likewise in the abdominal area, the diaphragm is constantly moving the organs. So this is the software that is provided, and the how should I put it, the quickness of the ability to scan someone has improved so dramatically. And as a result of that, software issues as well as the imaging, I'm not sure how to explain it, the imaging head, as it were, they can detect lesions down to 2 millimeters. 2 millimeters is very small. That's a very large pencil point. I mean, that is very tiny. The other thing that it can do is that there's faster turnaround time, which is very important, especially for patients here. We have a very challenging situation where we have people coming in from all over the country, and our turnaround time is second to none in terms of having the patients here, being able to diagnose exactly what's going on, and then being able to give them a treatment plan and start treatment quickly. The next modality that I'll talk about is called QuadraMet. Now, this is important to discuss because there are a lot of cancers, especially breast, prostate, lung, and multiple myeloma, which very commonly metastasize to the bones. And this can be a devastating situation because if you think about it, anyone that has had a fractured arm knows how painful it is. And this is a situation that we're talking about. Only these patients can have multiple lesions in multiple areas of the body. And the bone itself does not have any pain sensors, but the layer around it, called the periosteum, is very rich with pain sensors. And they sense any kind of stretch or break in the bone itself. And, a normal bone has cells, different cells actually, that break down bone and build up bone. That's normal. Our bones are constantly remodeling. But like any type of metastatic disease, these cells go out of whack and they start multiplying rapidly, causing this pain. Now, if the pain is very localized to one area, radiation therapy can frequently take care of these. But if there's multiple areas of the body, one of the treatments that we have is what we call QuadraMet. It's a radioisotope called samarium-153 that's simply injected into the body. And this isotope is radioactive, and it goes, or I should say it goes everywhere, but it's absorbed preferentially by these malignant cancer bone cells, and it will destroy them. And so it dramatically can help in terms of pain levels. Now I want to talk a little bit about the challenges that we face here, actually that any cancer center faces, but how we deal with it. I'm going to talk first about advanced stage lung cancer. One of the things about cancer treatment centers and why we do as well as we do is that we are really geared up for the treatment of advanced stage cancers. This is the majority of what we do, and we're very good at treating these. And you can see from these graphs how well we do in comparison to other centers. Now, I have to mention that we're talking about apples and apples here. This is this comes from a database from the National Cancer Institute called the SEER, S-E-E-R database. It stands for Surveillance, Epidemiology, and End Results. And this is a standardized database that all cancer centers have the option of giving their information to. So we really are talking apples and apples. And as you can see, for instance, with advanced stage lung cancer, that at least at surviving out 1.5 years, the estimated survival is 1.84 times that of the national average as given by the SEER database. The next one is on advanced stage pancreatic cancer. And there, again, we're talking about up to 18 months out from entry into the system, that we have about 6 to 18 months, 6 to 18 months out from that we have twice the survival compared to other centers. And this is an interesting slide, and if you look at it closely, and I'll point this out to you, the cancer center is in the dark green and the SEER database is in the blue, and you can see that as time goes out past 2 years, that actually our results are slightly less than the SEER database. And the reason that we are showing this is that we are always striving. This is what we're all about. We are there to come up with new and innovative treatment plans for these patients. Now, this next area is near and dear to me. As I was introduced as being an anesthesiologist, I do have a subspecialty in pain management, but I also was board certified recently in palliative medicine. And palliative medicine is really quality of life medicine. And so this is what I strive for every day. This is my specialty. And a study was done here talking about achieving symptom control in cancer through these innovative treatments. And this study showed or evaluated 223 patients, and whether or not 3 months of intensive integrative treatment could lead to improvement of patient symptoms. And it did show that there was a statistically significant improvement in several aspects in terms of pain, shortness of breath, insomnia, and constipation. Now, I just want to elaborate a little bit and divert a little bit from this slide in talking about quality of life issues. My wife gave me a plaque that I have in my office that I find reassuring every day. It's a quote from Abraham Lincoln that says, "It's not the years in your life that count, but the life in your years." And this is an issue regarding quality of life. Now, obviously, we fight every day for survival of patients, but of equal importance is quality of life. And we know this all too well because most patients that come here have already been through other institutions and have had multi-line therapies, whether it's surgery, chemotherapy, or radiation therapy. And they're all too well aware of what they're facing with further treatment. And we have a department that's set aside specifically for quality of life issues. The other thing that I would mention is that one of the things that is very innovative here is that on a weekly basis we have all of the CAM, the complementary and alternative medicine clinicians that meet together, and we visit with all of the inpatients. And actually we just finished rounds this morning. It's called Comfort Rounds. And it incorporates all of the CAMs, the naturopathic physicians, the physical therapy, nutrition, mind-body medicine, pain management, pastoral care, pharmacy, administration, care management. And so there can be sometimes upwards of 12 to 15 clinicians going into each patient's room, visiting with them, joking with them, having a good time with them, but also addressing quality of life issues. And so this is part and parcel of what we're all about. Let's talk just a little bit about surveys. Everyone is skeptical about seeing surveys because you don't know where the numbers are coming from. But these numbers are coming from independent surveys that have been done on behalf of CTCA. And one of the things that's amazing is that the overall satisfaction with CTCA is 99%. And the world-class company benchmark is 80%. The Ritz-Carlton really only achieves 85%. And there are two specific questions that we ask patients. Is, would you definitely recommend CTCA, and would you bring your mother to CTCA? And both of them overwhelmingly show that that is exactly what they would do. Now, the one thing that is interesting is what is referred to as the Net Promoter Score. And this really kind of separates the wheat from the chaff, because what it does is it is a numeric calculation that where you take the promoters versus the detractors from a survey, and this really puts everything on an equal level for everyone to compare things against. And our Net Promoter Score is by far higher than other corporations. And I'm not just talking about hospital-based corporations. I'm talking about industry in terms of automobile companies, hoteliers, anything. And we are proud of that fact. Now, the last slide that I'll show you is just kind of physically who we are. The first hospital was opened by Mr. Stevenson, our CEO, back in 1975 in Zion, Illinois. And the hospital in Tulsa is long established. And ours was established back in June of 1990. Now, it was 4 years ago that we had the opportunity to build our own facility, and it's an absolutely gorgeous facility. And unfortunately, after 4 years, I think we opened almost to the month 4 years ago in the new facility, we can't keep up with growth. The patient volume is expanding so rapidly, and as a result, we have a massive building program now where we're increasing the number of hotel rooms within the hospital facility as well as the clinic itself. And, you know, I guess the thing that I would close with is the reason why patients come here and subsequently stay and have treatment here is because of exactly the reason that Dick Stevenson sought to develop this hospital, this system, and these mission visions and values that we have, is because the problem that he had is the same problem that all of these patients that come here have. They're looking for treatment, but they're also looking for hope, and that's what we're here to provide for them. So with that, I'll close my end of this.
Well, thank you very, very much, Dr. Ellison and Dr. Axness. Can you hear me okay?
Yes.
Yeah, we hear you well.
Okay, great. This is just to say that I have, ever since I heard about this institution, I have been so impressed with it and with what you do, and you truly are a shining light to the world about how to take proper care of patients. And really, I probably would not have left oncology, radiation oncology, if I had known about an establishment like this long ago. So it is truly an honor to really know about you and what you do, and how showing the world, showing hospitals how to get it right. And we believe that the time is coming very soon when patients will begin to actually demand the kind of treatment that you are already quite accustomed to giving in your establishment. And we're just honored to be able to play a part in getting the word out concerning what you do. Folks, just to remind you, you can type in questions into the panel to the right of your screen. Just click on the chat box, and then you can type in your questions. Now, Dr. Axness and Dr. Ellison, what I think we can do is that while the questions are coming in, if you already have the slides with the pictures, if you would not mind actually just going through those other slides and kind of like discussing them and giving us some insight into what goes on. And I know Dr. Ellison mentioned it earlier on. People definitely want to hear more about all those different departments and how you work around the patient and give the patient optimum care. So if you would just click through the slides that you have, and then we can ask questions and talk about that as we go along.
Are you asking for a response to that now, Dr. Ajabadi?
Well, I'm basically asking it, since you already have the slides, I'm assuming you still have the slides that that we sent you. Do you have, is this your last slide on your presentation?
Yeah, this is the last slide of our presentation. I think someone had mentioned that perhaps someone else had
okay.
the slides.
Okay. Okay. Well, great. I'll do that. So what I have them with me, and I'll just change presenters to myself, and then I'll take you through the slides, if that's okay. All right. Hang on just a minute, folks. And here we have a whole bunch of them. All right, are you seeing my screen right now?
Yes.
Okay, great. So we have a picture of the cancer treatment centers, which was the last one Dr. Axness showed. And this is Dr. Daniel Nader. I'll just kind of like go through these slides, and if you want me to stop and we can talk about it, or if I see something that is interesting, we might talk about it some more.
Well, I could comment. I could comment on this.
Right.
Dr. Nader is extraordinarily innovative in being a pulmonologist, a lung specialist, and he has developed unbelievably innovative techniques to address not just treatment of lung cancer, but also the ability to go in and non-invasively or minimally invasively diagnosed by really unique biopsy techniques. And we don't have enough time to get into that now, but it has totally revolutionized how we understand what level of cancer a patient has in terms of lung cancer or even metastatic disease to the lung.
Okay.
And Dr. Simeon Jagannath is one of the medical oncologists here. He's one of the 5. And again, he is extraordinarily innovative in what he does. He is absolutely zealous about his patients and the treatments that he gives for them. Yeah, well, we just feel so honored to be with these specialists. Gerald, maybe you could comment about
Pastoral care is a very important part of the services available here. We have a pastoral care staff that is available 24/7 to patients, to caregivers, and the service is appreciated. We hear over and over again very deeply by patients and caregivers.
Okay. This is your cafeteria, I can see. I know patients have the question always asked about nutrition. What do I do with cancer? What food should I eat? What food should I not eat? And I understand you have a good nutrition team that actually helps to answer those questions.
Exactly. And I guess I would kind of back up just a little bit to mention that all of these CAM services, the complementary and alternative medicine, are not add-ons. They're certainly not fluff. They're absolutely integrated into our treatment plans. As a matter of fact, each medical oncologist has a nutritionist, a care manager, as well as a naturopathic physician that is assigned to them. So each patient that's seen by the medical oncologist is also seen by their own team of nutrition and naturopathic medicine.
Wow, that's great. And this is hypothermia. How does this work?
Well, this is an adjuvant kind of technique for treating certain types of superficial cancers like melanoma. And this is something that we've started doing here. And Dr. Petra Ketterl, one of the medical oncologists, has kind of spearheaded this. But I should also say that Dr. Pierre Griff, our surgical oncologist, has been doing this type of thing for literally decades, and he really pioneered a lot of this. So we have a lot of experience in this.
Okay. Okay, as an education class. This is Dr. Axness with his patients. Do you always counsel and talk about pain management and just the importance of keeping pain under control before you start treatment? How do you go about this?
Yeah, typically we see patients on the first or second day of their arrival to CTCA to at least do an initial pain assessment. And unfortunately, a lot of patients come in here woefully and inadequately treated for their pain. And so it can be quite a challenge initially to get their pain under control. And we'll see them back sometimes twice or 3 times daily initially. And certainly every day or every other day is very common initially until we can get their pain under control. And the modalities that we use are, mostly medication, but we also use interventional techniques when needed.
My understanding is that the 2 main things that patients that really complain about the most are the pain and fatigue. And that if you can keep the pain under control, there's a better chance of them responding to treatment and getting remission.
Well, exactly. And again, these patients really can suffer tremendously going through a treatment regimen. And so we're there to support them every step of the way, continuing to focus on quality of life, because we don't want them to falter and not being able to complete their treatment. And usually we're able to do exactly that by keeping up with their symptoms and, in terms of everything. And like I say, on comfort rounds when we see them, we're talking to them about every aspect of concern. It could be spiritual, it could be emotional problems. We deal with financial and logistical issues. So anything that's of concern to the patient or the caregivers is something that we will get on right away to eliminate that as a barrier for their treatment.
David, it's important to keep in mind that some of these factors like pain suppress immune functions, which means that the system cannot do what it was designed to do adequately. And they also, pain, depression, anxiety, for example, also waste lots of energy, which could be used for work or travel or whatever the person does. One of the more powerful features of issues like pain and anxiety, both of which are fairly prominent within our population, is that those items interfere with the thinking processes, particularly anxiety at the more intense levels. And when a person is not able to think as clearly, gather information like he or she normally would, or make judgments, in as effective a way as normal, things just don't go very well for that individual as well as they could. So it's important to get these things that are such huge hindrances managed or out of the way as quickly as possible, and certainly pain is one of those. Sometimes the spiritual domain, which is addressed by Pastor Michael Langham, who is Director of Pastoral Care, is so important to a number of our patients, and we utilize their services fairly freely. Patients request those services quite frequently because what happens in the spirit domain for those individuals affects what's going on in the rest of the person's life, including whatever the person can or cannot do regarding treatment. So again, coming back to the whole person concept is critical if we're going to maximize that person's capacity for healing.
Mm-hmm. Mm-hmm. Now, CTCA talks a lot about hope. As a matter of fact, it's on your website, it's on your email addresses, it's everywhere. How important is hope to the whole healing process?
Well, one of the things that we often talk about here is that when there's no hope for the future, there's little power for healing in the present. And over again, patients talk about the importance of hope to their journey. And they will make comments like, well, my hope was shredded before, or my hope was diminished so powerfully before, and I've reconstructed it. I now have hope, a substantial hope again, which means to them, and in very practical terms, it means that they can go on with treatment with a reasonable level of confidence. They can do things with their family, sometimes with work, and get on with life in a more effective way when they're operating from a base of hope. It's absolutely critical to help people have and maintain a high level of hope if we're expecting that individual to do well in the recovery journey. So we look at that very early in the assessment process. If the person has very little hope, we see it as one of our responsibilities and opportunities to begin as quickly as possible to help in the reconstruction of that hope. And one of the things that helps a lot with that is to provide adequate, accurate, and usable information quickly. And we do that as best we can. And if we don't have the information, we'll try to get it. But another thing that is critical to having a strong level of hope is to have affirming personal relationships. We're thinking most likely family relationships or maybe friends, or anyway affirming personal relationships. And sometimes we need to help bridge the communication gaps between, say, spouses who may have gotten crossways or maybe having some significant difficulties in the communications process as they get into the treatment. And we can help them bridge those gaps so as to restore those affirming personal relationships. But there's another factor that is absolutely critical. There are two key factors, in fact, in the maintenance of strong hope. One is affirming personal relationships, and the other is relationships with caring staff. So when we talked earlier about our core values, I hope no one took that as our just having something to say or providing some conversation along the way here tonight. These are critical, absolutely a must if we're going to help patients do the kinds of things they need to do to heal. Having hope is one of those key things that must be attended to, and if we do not have a set of caring relationships as staff with each other, we can't very well teach and provide such, teach the patients to have such and to provide that for them. So we have to attend to these 7 values that we talked about earlier, both in terms of how we deal with patients and caregivers, but also in terms of how we relate to one another. And so we do things along the way to help strengthen our own relationships with each other so that we can do the best job we can do for our patients and caregivers.
Well said. Well said.
If I could interject something, these values that Dr. Ellison has talked about really come from the very, very top down. These are the values that Dick Stevenson has developed, and this is what he really believes. And I would really like anyone, I'd love everyone to meet this man. He is a hard-driving businessman, but he's also such a nurturer to the staff. I mean, he really exemplifies these values that he wants everyone to have. It exudes from him, and as a result, the clinicians, all of the employees, really value him, what he has instilled in this institution, and they want and they do have these values themselves.
Wow. And he travels around and visits different centers and has meetings. He's basically seems like he stays on top of things. I understand he was at the clinic at the hospital last week or so.
Well, he comes frequently, and he comes unannounced, and he loves to go and find a patient or more and ask them how are things going. And based upon not just that, obviously, but a lot of his direction for that particular visit to the hospital can be directed by concerns that the patients have, and how are we going to make this right in terms of helping this patient through their journey.
That is great. That is great. I just wanted to pick up on what Dr. Ellison also said about the importance of support, social support, family support. There was this research that was done. Actually, it was done by a skeptic. It was a doctor who didn't believe that emotional support had any effect on cancer whatsoever. And so he decided to do actually research and actually do a test to see how true it was. And folks, after the test, what they did was they tested over a period of about 6 or 7 months. They studied people with advanced breast cancer, and then they watched them for a couple of years. And what they found out, folks, was that the people who had good, strong family ties and good, strong social support, on average, lived twice as long as the people who did not have such support. So it is extremely important, and that's my heart just jumps at the fact that Dr. Ellison talks about this and how important it is not just to have good social support with family-wise and amongst close relationships, close relations, but also between the patient and the caregiver, the health caregiver, the doctors, the naturopaths, the chiropractors, and all that. I think that is so important. And so this is just fantastic. I just want to say thank you again to our doctors, Dr. Ellison and Dr. Axness, for giving their time to prepare for this and to really teach us about what this amazing institution called Cancer Treatment Centers of America is doing. Thank you again, gentlemen.
Thank you.
Thank you for the invitation.
Absolutely. I just want to leave us with one quote, this quote by Lance Armstrong. Sherry just sent this to me. If children have the ability to ignore all odds and percentages, then maybe we can learn from them. When you think about it, what other choice is there but to hope? We have two options, medically and emotionally. Give up or, forgive my French, fight like hell. By Lance Armstrong. And again, with that, I'm going to close the webinar, and hopefully we can get Dr. Ellison and Dr. Axness sometime in the future again to give a presentation for us. So again, thank you, and everyone have a great night, and we'll probably see you next week to join us for the webinars, the upcoming webinars. God bless.